ওয়েল মাই ফ্রেন্ডস, আজ বৃহস্পতিবার, চেম্বার বন্ধ। তাহলেও ছুটির দিনে অনেকে আসছে। আবার একজন এসে গেছেন, 43 বছর বয়স্ক ভদ্রলোক। ওনার পেটের সমস্যা। কেস হিস্ট্রি লেখা হয়েছে মিউকয়েড স্টুল। পেট নিয়ে অনেক সমস্যা আছেন। হি ইজ এ ভেরি নার্ভাস পারসন। সো whenever there is abdominal disorder along with nervousness, recurring passing of stool small quantity in nature, the disease is no doubt irritable bowel syndrome. আগে ডাক্তারবাবু তাই বলেছে, ইরিটেবল বাউল সিনড্রোম। এমনি নার্ভাসনেসটা বেশি আপনার, পেট নিয়ে কী হবে না হবে এসব ব্যাপারটা নিয়ে। সো ইরিটেবল বাউল সিনড্রোম, as already I have discussed in many of my videos, irritable bowel syndrome, Crohn's disease, and ulcerative colitis are the three diseases togetherly called inflammatory bowel disease. Inflammatory bowel disease. There are difference. Irritable bowel syndrome is characterized by recurrent abdominal pain and discomfortness in association with abnormal defecation. Recurrent abdominal pain with discomfortness of abdomen, with abnormal passing of stool. There, in these cases, the stools are generally mucoid. Ulcerative colitis, the stool is generally bloody. And in Crohn's disease, stool may be bloody, may be mucoid. So the irritable bowel syndrome, generally patients are diarrheic or alternate constipation and diarrhea, but with always abdominal discomfortness, flatulence, a sense of distension in abdomen, and always mental irritability and agony. Other two diseases, there is no nervousness, no mental agony and irritability. The cause is unknown or incompletely understood. But it may be considered that some biological, psychological, and social factors are responsible for this disease. The psychosocial factors are very important. The pathology is that a low-grade gut inflammation with raised number of mucosal mast cells. I do not like to describe more pathology in this case. The clinical symptoms are more important. The clinical symptoms are recurrent abdominal pain, as already I have told, usually colicky or cramping in nature, felt in the lower abdomen and relieved by passing of stool. Most patients alternate episodes of diarrhea and constipation. Management is very important. Reassurance and explanation to the patient is often beneficial and helpful. Many patients are fearful and they have developed fear of cancer. Their anxiety cannot be broken by explaining that symptoms are not due to a serious underlying pathology, but instead are the result of behavioral, psychological, and physiological or luminal factors. Dietary treatment is also effective. In Crohn's disease, the type of inflammatory bowel disease, where the entire wall of the bowel becomes edematous and thickened, and there are deep ulcers, obstructions, adhesions of the intestinal loops. And ulcerative colitis, chronic inflammatory bowel disease of the large bowel will cause ulceration of the mucosal membrane of the rectum especially, and can involve the whole colon also. The cause is also unknown. The main symptoms of the ulcerative colitis is passing of bloody diarrhea with watery containing mucus. These stool may be frequent as much as 10 to 20 times per day and may contain entirely even fresh blood and less fecal matter. However, I have compared in many videos. In these videos, once again, I have compared about these three inflammatory bowel disease. But homeopathy treats the patient, not the disease. Our patient requires pulsatilla because there is totally dry tongue, dry tongue, mild temperament. Pipasa, come on. Pipasa, come. So, first place, dry tongue, changeability, mild temperament. Our prescription is pulsatilla. So I do like to prescribe pulsatilla in 50 millisimolar scale of potencies with the direction twice in a day, morning and evening. Let's see the result. I shall share you about the result of this irritable bowel syndrome case, my friend.